Health Minister Dr. Christopher Tufton informed the House of Representatives of the prediction on Tuesday. He was responding to questions asked by the opposition about the models that were being looked at. The minister noted that while he is not in the prediction business, the 8-week period comes from the modeling.
The prediction is that the apex would occur 8 weeks after community spread begins. Now we're seeing signs of community spread now. Just about. This is not the BPO now. This is based on the centennial sites and the numbers that we see popping up that have no direct links to contact tracing. And as a consequence, we are going to watch it over the next week to see what happens. But once you see that starting, then what the clinicians say, the epidemiologists, is that you should see the apex within an 8-week period and then a decline.
Jamaica's first COVID-19 case was reported in the second week of March this year. The minister notes that the country is just entering the community spread phase of the virus. With the 8 weeks projection, relief is not likely before June. And it's still anyone's guess as to when the many Jamaicans who are at sea or otherwise will be allowed back under a controlled re-entry protocol.
For example, one of the protocols that would be in place is the quarantine requirement. That if you're going to allow re-entry, whoever is coming in must be quarantined. If the government, by assessment, determines that the quarantine should be in a state facility, then clearly we have over 5,000 people wanting to come into Jamaica, citizens wanting to come back home. We don't have 5,000 rooms, and we don't have the health officials to be able to appropriately administer and supervise this operation. And therefore, the re-entry has to be controlled. In other words, we can only let in the number of rooms that we have identified and the administrative public health staff and medical staff to supervise a state quarantine. So those are limiting factors.
Javaughn, Frontline News.